Hello everyone, welcome to JJZACH Medical. In today's video we are going to be looking into the medical terminology of the respiratory system. At the end of the video, if you did like it, please make sure you click on the like icon and also you subscribe. Make sure you allow all notifications so that you don't miss an upload. Thank you. To start off, let's go ahead and check out the organs of the respiratory system. So we have the nasal cavity over here. We have the pharynx, which is going to allow food to go through the esophagus, and air is going to go through the larynx. We have the larynx, we have the trachea. Trachea is pretty long. We have the bronchial tubes, and we have, of course, the lungs. So as you can see, this is a trachea. This is the thymus. This is the apex of the lung. This is the left upper lobe. This is the right upper lobe. This is the right middle lobe. This is the right lower lobe. This is the heart. It's in the mediastinum. This is the left lower lobe. Left upper lobe. This is the left lower lobe. This is the base of lung, and this is the diaphragm. This is the base of lung. This is the diaphragm, of course. This is where, when you breathe, it's going to push the lungs and allow air to come inside. So here are some terms. The nasal septum. This is the wall dividing two nostrils, septoplasty. This is the surgical repair of the septum, anosmia. This is without the sense of smell kind of condition. Epistaxis. This is nosebleed. This is also referred to nasal hemorrhage. And dysphonia, this is bad, impaired voice quality. Break up the term, dysphonia. And then adenoidectomy, this is the excision of the adenoids. Sinusotomy. This is the incision of the sinuses to improve ventilation or drainage. And then we get the epiglottis. This is a medical emergency of inflammation of the epiglottis. So make sure you're familiar with these, especially with conditions like the epiglottitis, dysphonia, things like that, and anosmia. And then we have rhinorrhea. This is nasal discharge, rhinorrhea. Pretty sure there's a spelling mistake there, but yeah, that's rapid blood flow. And then we have cilia. That's hair-like structure in the trachea. Cilia escalator, this is a mechanism produced by the cilia to move particles upward to the pharynx where they are removed by coughing or swallowing. Then tracheoplasty, this is the surgical repair of the trachea to correct a narrow or stenotic trachea windpipe. If you have a narrow trachea or stenotic trachea, that could be bad, so we're going to have repair there. And then we have eupnea, dyspnea, mortopnea, tachypnea, bradypnea. Hyperventilation, this is breathing too fast and too deep. Hypoventilation, breathing too slow or too shallow. Note the key words here, hyper and hypo. And then apnea, this is a temporary loss of breathing, includes sleep apnea or cardiac apnea. And then you got pneumonectomy, this is the excision of all or part of a lung. And this is a lobectomy. This is a surgical removal of a lobe. And then pneumonia. This is a condition of infection of the lungs. Pneumoconiosis. This is a condition of accumulation of mineral dust in the lungs. And then anthracosis. This is an abnormal condition of coal dust in the lungs. Atelectasis. This is the incomplete expansion of the lung, also called aorist lung or collapsed lung. And then atelectasis is a potential complication of some surgical procedures, especially those of the chest breathing, because it's commonly shallow after surgery to avoid pain from the surgical incision. In fatal atelectasis, the lungs fail to expand normally at birth. And that, of course, could be a problem. And then we got the phlegm. These are thick mucus secreted by respiratory tract. Sputum, phlegm coughed up from the respiratory tract. Hemoptysis, coughing up or spitting of blood or blood-stained sputum. And then sputum culture and sensitivity, CNS. These are culture sputum for bacterial growth if present, then determines best antibiotics to use. And then sputum cytology, examining sputum for malignant cells. And then pleurisy. This is inflammation of the pleural membrane characterized by stabbing pain that is intensified by coughing or deep breathing. This is also called pleuritis. And then pleural effusion, accumulation of fluid in pleural cavity, prevents lungs from fully expanding. And then you have pleurocentesis. This is the surgical puncture of the pleural cavity. This is also called thoracocentesis. Or thoracentesis. And then we have pneumothorax. This is a collection of air in pleural cavity. This may result in a collapsed lung. In atelectasis, the lung collapses due to decreased pressure inside the lung, while in the pneumothorax, it is due to pressure spelling mistake there, on the lung from outside. And then pyothorax, this is pus in the chest, this cavity. Also called empyema, that's another word. Pyothorax is usually caused by penetrating chest wound or spreading of infection from another part of the body. So, yeah. And then here are some diagrams here. This is a needle inserted to the pleural tube to withdraw fluid. And as you can see here, this is the torn pleura, outside air entering the pleural cavity. And this is the left lung diaphragm inspiration. So it's just kind of showing you the procedure, and yeah. Alright, moving on. Pulmonary edema, accumulation of extravascular fluid in lung tissues, and sorry, kind of blocking that, but it's caused most commonly by heart failure. Excessive fluid in the lungs induces coughing and dyspnea. And next, pulmonary embolism. This is a blockage in an artery of the lungs caused by a mass of undissolved matter such as blood clot, tissues, air bubbles, and bacteria. Pectoralgia. Remember, algia means pain, so pain in the chest. Also called thoracalgia, thoracodynia, and pectodynia. And then asphyxia. Sorry for my pronunciation. A condition caused by insufficient intake of oxygen. Some causes of asphyxia are drowning, electric shock, lodging of a foreign body in the respiratory tract, inhalation of toxic smoke, and poisoning. Alright, croup. Common childhood condition caused by inflammation of the airway, which obstructs breathing and causes a characteristic barking cough involving inflammation of the larynx, trachea, bronchial passages, and sometimes even the lungs. With Rowlenia conditions, this is a common childhood one. And then we get asthma. This is an inflammatory disease of the bronchi that produces spasms in the bronchial passages. These are bronchospasms. Coughing episodes produce a large amount of mucus, productive cough. Asthma is most commonly caused by exposure to allergens or irritants. Other causes include stress, cold, and exercise. And you maybe know someone with asthma, and you might recall that they have large amounts of mucus. Maybe it could be caused by allergens, irritants, things like that. And then we get the chronic obstructive pulmonary disease, COPD, a chronic partial obstruction of the air passages. So basically what happens is that the patient finds it difficult to breathe. This is called dyspnea. This is especially upon exertion and usually exhibits a chronic cough. And then bronchitis. This is characterized by swelling of the mucosa and the heavy productive cough accompanied by chest pain. Remember, itis means inflammation, break it up, and bronch. And then emphysema. This is characterized by decreased elasticity of the alveoli. The alveoli expand, which means dilate, but are unable to contract their original size. And then influenza. This is probably known. This is a flu, and this is an acute infectious respiratory viral disease. And then we get hypoxemia. This is the deficiency of oxygen in the blood. And then we get hypoxia. This is deficiency of oxygen in the tissues. Remember, break up the terms. Oximeter, an instrument used for measuring the percentage of hemoglobin saturated with oxygen. An oximeter is usually attached to the tip of a finger, but may also be placed on a toe or earlobe. And then we got hypercapnia. This means excessive carbon dioxide, or CO2. And capnia means carbon dioxide, hyper means above average or above normal. And an arterial blood gas, ABG. This is a test that measures partial pressure of oxygen, PO2, carbon dioxide, carbon dioxide, PCO2. pH, this is acidity or alkalinity, it can be up or down, the pH, and bicarbonate level of an arterial blood. So the ABG analysis evaluates pulmonary gas exchange, and it helps guide treatment of acid-base imbalances. Good test there. And acidosis, excessive acidity of body fluids. Respiratory acidosis is commonly associated with pulmonary insufficiency and the subsequent retention of carbon dioxide. Tuberculosis, TB, this is a bacterial lung infection. This results in inflammation and calcification of the lungs. That's not good. And cystic fibrosis, congenital disease, is CF. This is a genetic condition. It produces a very thick mucus that causes severe congestion in the lungs, which can lead to many problems. And then throat culture. This is a test used to identify pathogens, especially group A, streptococci. Aspiration means inhaling food or liquid to the trachea. Sudden infant death syndrome, SIDS, completely unexpected and unexplained death of an apparently normal, healthy infant, usually less than 12 months of age, and this is also called crib death. Expectorant. This improves the ability to cough out mucus. Expectorant, I'm very sorry. And then we got mucolytic. This liquefies mucus, so it's easier to cough. So we got some medicines, or you know what I mean. And antitussive. This relieves the urge to cough. And the ventilator. This is a machine that provides artificial ventilation for a patient unable to breathe alone. And this is the end. Thank you so much, and please subscribe, like if you did enjoy, and I will see you in the next video. Thank you. And one more tip before I end. Make sure you know your terms. Make sure you know how to break up a word. It will really help. Stuff like bronchitis. And what I'm going to do with these words, actually, tell me what you think about these words in the chat, and I'll let you know if you're correct. So thank you. Bye. Hey, do you want more videos of this? Make sure to check out these videos, like, and subscribe. Thank you.